My name is James Trotter, and I'm the Director of Hepatology at Baylor University Medical Center in Dallas, Texas. At our center, we do a large number of liver transplants, around 4,000 since the inception of our program 28 years ago, with somewhere around 20 to 25,000 encounters per year through our whole practice. So a large number of complicated pre and post liver transplant patients. The problems that we face here in Dallas are similar to everywhere. Hepatitis C is our most common problem. Globally, there's around 3 million people infected with this. Non-alcoholic fatty liver disease is probably our next most common disease, and that's really growing in prevalence. In the United States, we see a fraction of patients with hepatitis B, but in our practice, not as common as other parts of the world. The reason that we use the Explorer in our practice is that we've been very impressed at the image quality, which is excellent, and the excellent results that we've seen with the shear-wave elastography. The images that we obtain simply with the ultrasound allow us a platform to use it for other purposes, primarily needle placement for liver biopsy and needle placement for paracentesis. We've been very impressed with the overall platform of the Explorer device. It's been something that's been very helpful in our busy practice with many complex hepatology patients. So the way we use the shear-wave elastography in our clinic is we probably do around 15 to 20 procedures per week with the device, and we use it on a clinical basis, and it takes really only between maybe 30 and 90 seconds to do the examination. It's done identically to ultrasonography, so it's very comfortable and simple for the patient. The most common way is a patient who has hepatitis C. While they're in clinic, you can perform shear-wave elastography on them, and while they're there having their initial evaluation or consultation, you can make a determination about the degree of chronic liver injury that they have. And we're using that on a routine basis to help us make clinical decisions about how we treat patients. And we think that it will probably cut down the number of biopsies that we need by about half. It's a way, I think, to obtain excellent imaging and at point of care measure the amount of chronic liver injury that you have. And so by the time the patient's left the clinic, you've really been able to assess them. And by using this non-invasive technique, we can follow patients over time to determine any disease progression or regression. And we've done that in many of our hepatitis C studies, and in patients who've had advanced fibrosis, we've been able to see improvements. And so it's a very effective way to non-invasively follow patients over time to assess chronic liver injury. Shear-wave elastography provides qualitative information instantaneously. So the color code for shear-wave elastography is blue, shows a liver that has little fibrosis. Red is a liver with extensive fibrosis, and there's gradations in between. So you can instantaneously get a qualitative measurement while the patient is there within around 30 to 60 seconds. And then quantitative assessment takes slightly longer, and it gives you more precise measurement of that qualitative assessment. We've been able to use the shear-wave elastography in a busy clinic setting. We've used it in somewhere between 600 and 1,000 patients. We've been able to correlate results with simultaneous biopsies in over 200 patients. We've been very impressed with the image quality and I think the platform. All of us, including some of the skeptical members of our team, have really come on board and found it to be universally helpful in the management of our busy practice. We encourage our colleagues to use this, and I think if they were to use it, they'd be very happy and pleased with the results of it.